orthopedic oncology is it's a relatively new subspecialty in orthopedic practice. You know, we are familiar with saying arthroplasty, joint replacement, you know, spine. These are the common field in orthopedics. So oncology is quite a new field. It's probably around in Malaysia for about 20-something years, but it actually initially started in a university setting. So University Science Malaysia and University Malaya are the two first centers that started orthopedic oncology practice probably about 20 years ago. But now we are expanding. There are probably about 20 to 25 of us in the whole country who does orthopedic oncology almost exclusively. So basically what orthopedic oncology deals with is mainly there are 5 things, right? So the first is sarcoma. So sarcoma, again, we have bone sarcoma, we have soft tissue sarcoma, then we have bone tumors, which are not cancerous, like bone cyst and all that. We deal quite a lot with bone metastasis. Bone metastasis means the tumor starts from the breast and then spread to the bone, right? So those cancers also comes under us for treatment. And occasionally we do a bit of work with skin cancers, especially when it involves the limb. So these are the main 5 areas that we deal with. So limb salvage surgery is basically removing the tumor entirely, at the same time keeping the limb so that you don't actually need an amputation. So this is where the limb salvage surgery started. So in the past 50 years, we have made a lot of advancement in limb salvage surgery, that we can actually remove a big portion of a bone or tissue from the limb, and we can actually reconstruct the defect using sometimes bone which is donated by people, sometimes implants, and by putting all this in place, the patient will be able to walk again with the limb.
So I do general orthopedics. My niche area is joint replacements. I do a lot of what's called fast-track knee replacement. So what I do is I get patients to walk almost immediately after surgery. So I get patients operated in the morning, walking on the same day. The advantage of this is that you have lower risk of things like deep vein thrombosis and pulmonary embolism, which are blood clots in the leg, which can be dangerous. So I've started actually doing this about 15 years ago, when there was a worldwide movement moving towards fast-track surgery, early mobilization, reducing the risk of surgery. I've also done the first daycare total knee replacement in Malaysia. So what we did was we had a patient come in the morning, get operated in the morning, be able to walk to the toilet by the afternoon, climb stairs in the evening, and home by about 5 o'clock.
For people that doesn't know what arthroplasty means, it actually means joint replacement surgery. It's one of the subspecialty in orthopedic. In general, actually, we have 9 subspecialty in orthopedic. So arthroplasty is one of the big group. I believe we are the first one that actually provide the service of robotic assisted knee replacement surgery. But with robotic, a lot of time the robot is so accurate because we actually input data into the robot as a computer, just like your navigation, okay? So with the robot, whatever you want, for example, let's say I want a 5-degree of external rotation, the robot actually will tell you, yes, now you're at 5 degrees of external rotation, not eyeballing, not feeling. The robot actually assisting us is provide as a tools for validation and navigation. So that is what the robot do, okay? The robot is tools there to help us, I would say, okay, to ensure 100% safety for the patient and the 100% accuracy for the patient.